Hi guys, so welcome to the channel. My name is Shola and I'm a registered mental health nurse working in the UK National Health Service. The purpose of this channel is to bridge the gap between nursing and finance, and is to support nurses, student nurses or registered nurses through their journey, the journey of nursing and also the journey of finance. We're going to help you have a better understanding of your pay slip, understand of your payroll, and make your money go a bit further. In today's video, I'll be talking to you about how to prepare for your nursing placement. So for those who are not aware, in the UK, we tend to do a degree for 3 years, a nursing degree for 3 years. In some areas, you can do a nursing degree for 2 years, and that's generally a master's. But for those who are doing a 3-year degree, the expectation is that you do 50% placement and 50% theory. In other areas, you might be expected to do 60% placement and 40% theory. I've done a video about how I ranked first class in my nursing degree. So if you want to see how I ranked first class in my nursing degree, then the link will be in the description, and the video might just pop up in the video shortly. Okay, so like I said earlier on, I'm going to be talking to you about how to prepare for your nursing placement. That takes us to the first point. The first thing that you need to do is to read the placement profile. So every year, shortly before you go on placement, your mentors or your course coordinator will send out an email with the allocations of placement. And when you get your nursing placement, or you get your placement profile, it's very important to read it, because that tells you the name of the hospital that you're going into, the ward that you're going to be going to, and who your mentor is going to be on placement. So the first thing that I'm expecting you to do is to read your placement profile and to familiarize yourself with the environment that you're going into. For those who are registered mental health nurses, you might find yourself going to do your placement in a PQ ward, psychiatric inpatient unit. You might find yourself going to a forensic ward, or to a school, to social care services, or maybe going to community services. So it's always important to familiarize yourself with the placement profile. The second thing I wanted to do when you're preparing for your nursing placement is to make contact with your placement. When you make contact with your placement, you need to speak to your mentor and say, hi there, my name is Shola, I'm a second year student, and I'll be starting my placement next week. You'll be very, occasionally you might come across situations where your mentor is not even aware that you're coming. So it's always important to make that contact and speak to your mentor and find out what time they want you to start on your first day. In some areas, you might be doing a long day, which is probably 7:30 to 7:45, or sometimes you might be doing a 9 to 5. So you want to find out what time they expect you in on your first day. Once you've made that contact, then the third thing I want you to do is to actually visit the hospital. You might not be allowed to go into the wards, but what you need to do is to drive around, go and find out about the parking, find out where you can park your car, find out how easy it is to get there, what the traffic is like. And I think that's the third thing I really think that is important that you look at when you're trying to prepare for your nursing placement. So now that you've read your placement profile, you've made contact with your placement, and you've also done a drive around, you know where to park your car, you know how to get to your placement. Then the fourth thing that I want to talk about is understanding the nature of your placement. For example, you might find, if you're a mental health nurse, you might find yourself going to a psychiatric inpatient setting. You might find yourself going to an acute inpatient setting. You might find yourself going to a forensic hospital or to a community placement. If you're going to a PQ ward, then you need to look at the common conditions or the common mental illness that people might come across, that people might be facing. For example, somebody might, in a PQ ward, might be going through a manic episode. It's always important to have a read around that and get a better understanding of what somebody who is going through a manic episode might require in terms of the level of support that they require, and also the nature of the ward that they might be going into. So it's always important to do some research around the nature of the patient on your placement ward. The fifth thing that I want to talk to you about is having a better understanding of the sort of medications that those patients might require. For example, if you're going to a psychiatric a PQ ward, then you might be looking at people using very high-level antipsychotic medication because they're having a psychotic episode or they're having a manic episode. So they might be using things like quetiapine, lorazepam, or some of them might be using things like mood stabilizer, like sodium valproate, and so on and so forth. Have a good read of the sort of common medications that you expect people to be using on that ward, and also look at the contraindications. Again, these days, most of our mental health patients have comorbidities, so they have physical health issues as well. Some of them are on vitamin because obviously they're in an inpatient hospital. Some of them are on vitamin. Some of them are on medication for simvastatin or other medications to do with their physical health needs like hypertension and so on and so forth. So once you know the nature of your patient, then you can go ahead and research the common medications that people might be using on that ward. The next thing I wanted to do, which takes me to my 7th point, is that I want you to be able to speak to other students who have been on placement on that ward. If you speak to them, you get to have a better understanding of what the expectations are. So when you speak to previous students, they will tell you about the nature of the patient, the common medications, and that will also help with your preparation. The final thing that I want to talk about is get to know your placement. For me personally, before I go to my placement, I've got the name of my mentor. I will do a bit of research around them. What are their likes and their dislikes? What are their achievements? Have they recently got an award because of their contributions to the NHS? Normally if you type their name onto Google or to a place like LinkedIn, you get to see a lot about your mentor and also speak to people about them as well. Find out what their likes are and their dislike. I've got a video which I did a few weeks ago about how to rank first class in your nursing placement, and that really tells you what you need to do to be able to secure a first class degree, and obviously the placement plays a very important part. As I've said in the beginning, nursing placement requires 50% theory, 50% practical, and if you're able to have a better understanding of your placement, then you're likely to secure a good grade in your placement. And preparation is the key. So thanks for watching this video. If you like what I'm talking about on this video, please don't forget to like, don't forget to share, and don't forget to subscribe to the channel. Thank you.